Hello, and welcome to Substance Abuse Prevention Advocacy Day, a step-by-step guide webinar.
Brought to you by Voices for Prevention and Georgia Department of Behavioral Health and Developmental Disabilities.
Substance Abuse Prevention Advocacy Day will be Thursday, February 20th from 9 a.m. until 2 p.m.
This event will take place at the Sloppy Floyd Building in the Floyd Room on the 20th floor of 200 Piedmont Avenue Southeast in Atlanta.
Parking can be difficult sometimes. Be sure to look up directions on the vp4ga.org website and bring them with you.
So what exactly is Prevention Day? Prevention Day is an opportunity for anyone, adult or youth, who is passionate about substance abuse prevention and wants to learn more about prevention advocacy and policy education. Stakeholders from across the state will get together and discuss various substance abuse and/or issues related to substance abuse prevention. Attendees will have the opportunity to network with others who are interested in the same prevention issues they are. Prevention Day is also a great time to schedule a meeting with your legislator and speak with them about what's going on in your community. So just who all should attend Substance Abuse Prevention Advocacy Day? You should, along with your coalitions, Community Prevention Alliance work groups, and your community partners, such as youth, parents, law enforcement, schools, businesses, media, youth-serving organizations, religious and fraternal organizations. Also welcome civic and volunteer groups, healthcare professionals, state, local, and tribal agencies with expertise in substance abuse, and other organizations involved in reducing substance abuse.
Registration begins at 9 a.m. When you arrive, you will have to present your ID at the front desk in the lobby of the West Tower. Please make sure you bring your driver's license or any photo ID. Remember, since this is a government building, your bags will be checked.
At the 20th floor, you will follow the arrow to the Floyd Room. If you've pre-registered, you will go to the pre-registered table and sign in. If you haven't pre-registered, you will go to the on-site registration table and fill out the registration form. Volunteers will then give you your information folder and will let you know which table you've been assigned to. If you are a leader for a youth action team, you can sign in for your team. The youth do not have to sign in individually.
The kickoff event will take place from 9:45 to 11:15 in the morning. We have some great guest speakers lined up for you at the kickoff.
You will be assigned to a table based on the substance or topic that you chose at registration. Some of the topics being discussed at the kickoff include alcohol, tobacco and vaping, prescription drugs and opioids, marijuana, and attendees will have the opportunity to network at their tables and go over the talking points for their chosen substance or topic. Each table will have a group facilitator available to give tips on how to speak to your legislator. And don't forget, boxed lunches will be provided at the kickoff. But we're not ready for lunch yet.
You will have an opportunity to visit with your legislators from 11:15 to 12:45.
For this portion of the day, attendees will walk to the Capitol. But don't worry, it's right across the street. Ideally, you will have made an appointment with your legislator prior to Substance Abuse Prevention Advocacy Day. But if not, you can still fill out forms in the Senate and House chamber hallways to ask your senator or representative to meet you at the Senate and House ropes. You may meet others at the kickoff and form groups to visit the same legislator. This is a great opportunity to share the talking points you discussed at the kickoff. Finally, there will be a rally at the south wing of the Capitol from 1 to 2 p.m.
Your rally speakers will be Governor Brian Kemp, Attorney General Chris Carr, and Dr. David Jernigan.
Have you already been thinking, what should I do before attending Substance Abuse Prevention Advocacy Day?
First thing, prepare your community information one-pager that you can share with your senator or representative. You can do this by pulling together local data from the 2019 Georgia Student Health Survey, also called the GSHS2, or other local sources. You may also paint a picture of your community's issues with substance abuse, or share what prevention efforts are in place and what successes you've had. Please note, a template for your community information one-pager can be found on our website, v4pga.org.
If you're not sure who your representative is, you can look them up on openstates.org or mvpsos.ga.gov. You may also look at the Georgia Senate website and find your legislator. We strongly encourage you to make an appointment with your representative.
Bring your youth action team. This is a great opportunity for youth to learn more about prevention advocacy and policy education. You can find a youth action team prep guide on our website. Did you know they may be able to receive school credit? Check with your local school system.
First, we'll need to discuss some of those table topics. Some of the topics being discussed at the kickoff include alcohol, tobacco and vaping, prescription drugs and opioids, marijuana. Underage drinking is a serious problem in Georgia. Alcohol is still the #1 drug used by youth in Georgia and the United States. More than 150 of Georgia's youth die each year from alcohol-related causes. Young people who began drinking before age 15 are 4 times more likely to develop alcohol dependence than those who began drinking at age 21.
Alcohol use constitutes as a serious public health issue for young people in the United States. Binge drinking, having 4 or 5 or more drinks within 2 hours, can have negative health, social, and economic consequences for the youth, their families, and communities. A social host amendment encourages responsible efforts on behalf of the adults to prevent underage drinking on property they control. Worldwide, tobacco use causes more than 7 million deaths per year. If the pattern of smoking all over the globe does not change, more than 8 million people a year will die from diseases related to tobacco use by 2030.
Nearly 25% of high school students in Georgia smoke. E-cigarettes are now the most frequently used tobacco product among adolescents. Some 2.1 million middle and high school students were e-cigarette users in 2017. Tobacco use and smoking do damage to nearly every organ in the human body, often leading to lung cancer, respiratory disorders, heart disease, stroke, and other illnesses.
Nearly 21 of every 100 high school students in the U.S., that's 20.8%, reported in 2018 they have used electronic cigarettes in the past 30 days. This is an increase from 1.5% in 2011.
In the U.S., more than 11.5 million people reported misuse of prescription pain medicine in 2016, and prescription drug use has reached epidemic levels in Georgia. Prescription opioids can be prescribed by doctors to treat moderate to severe pain, but can also have serious risks and side effects. And friends and family are the source of 70% of prescription drugs that are abused.
Fentanyl is a synthetic opiate pain reliever. It is many times more powerful than other opiates and is approved for treating severe pain, typically advanced cancer pain. Illegally made and distributed fentanyl has been on the rise in several states. Heroin is an illegal opioid. Heroin use has increased across the U.S. among men and women, most age groups, and all income levels.
Marijuana is the most commonly used illegal drug in the United States, with 37.6 million users in just the past year alone. Marijuana affects brain development, particularly when people begin using as teenagers. And about 1 in 10 marijuana users will become addicted. For people who begin using before the age of 18, that number rises to 1 in 6. We would love your help promoting this event in your community. Like us on Facebook and share our posts on your social media pages. You can also find a copy of our press release at www.v4pga.org. Thank you for being part of our webinar. We are looking forward to seeing all of you at Substance Abuse Prevention Advocacy Day